Hey everyone, welcome to part 2 of our coronavirus and surgery vlog, where we talk about how the coronavirus is changing your surgical experience. I'm Dan, I'm one of the nurse practitioners and patient partners here at Right Device, as well as an orthopedic nurse practitioner. But before we get started, don't forget to hit that subscribe button so you can get the latest up-to-date videos from us, as well as surgeons from around the country about how they perform their specific orthopedic surgery. Also, check out our website where you can join to find a patient partner who has had the same exact surgery like you, as well as our medical device database where you can get the latest reviews, updates, and studies regarding your medical device. In part 2 today, we'll talk about the processes that have been implemented in many hospitals around the country during the pre-op and post-op phase to ensure that you're safe as well as everyone else is safe during their recovery period. We'll also go over a little bit of what happens intra-op, but most importantly, we'll stay focused on the pre-op and post-op phase. So prior to surgery, your surgeon will require you to undergo some pre-op testing. And usually that includes some imaging, some blood work, maybe following up with your primary care or your specialist to make sure you're medically optimized for surgery. So now, in addition to that, you'll likely have to do a coronavirus swab to make sure you're negative, probably a few weeks or a few days prior to surgery. So in between that time doesn't mean you're at any less risk for getting infected. So it's important that you still keep wearing your mask and washing your hands to make sure you're not infected prior to surgery. So the day of surgery, likely you'll be screened one more time at the entrance to the hospital. Usually they'll take your temperature at the entrance, as well as ask if you have any fevers recently, any chills, coughs, nausea, vomiting, and if you have traveled anywhere that's been a high-risk area. So now you're in OR holding, you're starving because you haven't eaten the night before, and despite all this, your surgery may still get postponed or canceled. Some of these OR processes now take a little longer, and cases may be delayed or pushed back because of it. Also, maybe an emergency surgery came through and had to bump your case. But don't get too frustrated. That means you have some extra time now to work through those prehab exercises, make sure your house is in order, and be even more ready for the recovery process. So the operating rooms are kept meticulously clean. There's sterilization processes in place for the room itself, as well as any of the tools they use to decrease any chance of infection. So right before you get put under, you may notice that there's less people in the room, as well as additional PPE for all the members that are inside the OR. So now you've made it through your surgery, you're taken up to your room where you can kind of take a break, get some rest, and the recovery process now starts. One of the first things that you might notice, even before surgery, is a new change in any of the visitor policies. A lot of hospitals and hospital centers now are limiting either the hours of visitors or the number of visitors that come through and visit each patient. Likely, they only allow one visitor at a time, and so someone may have to wait in the car while another visitor comes to visit you, and then they have to switch. Limiting visitors is meant to prevent overcrowding in the rooms, prevent anyone from bringing the virus in from outside or any other sources of infection. You can take this time actually and take advantage of it and have your visitors visit you at home instead of at the hospital. That way they can also help you as well when you're at home. Just like you got screened at your entrance of the hospital, your visitors will be screened at the entrances of the hospital as well. So if they feel kind of a little under the weather, it may be best if they wait at home until they feel well before they visit you. That way it decreases the risk of you getting an infection and them getting an infection as well. So even under normal circumstances, the longer you stay at the hospital, the higher risk of complications that occur, such as infections or blood clot. But even now with coronavirus, expect to be pushed for discharge a little bit earlier. And that should be your goal as well, to get home as soon as you can. That way you limit your infection risk, as well as you're a lot more comfortable and you can sleep at home actually. So if there's any issues prior to discharge, definitely let your social worker or your physical therapist or occupational therapist know as well. Some logistical issues there may be a few steps to get up inside your house, or you may need grab bars for the tub. Your physical therapist or occupational therapist can get those squared away for you. Or if you have issues at home in getting around, a social worker can help you look into alternative discharge plan. So what happens in the worst case scenario, you do get coronavirus while you're there? Likely your stay will be extended to make sure you're medically optimized to be discharged. Once you're discharged, you may have to quarantine at home for 14 days before anyone else can visit or before going out again. If you have any high-risk individuals living at your house, such as small children or elderly parents, definitely let your social worker know so they can find some sort of alternative and safe discharge plan to keep your family members and you safe as well. Thank you guys for joining me on part 2 of our coronavirus and surgery blog series. In part 3, we'll talk about the things that you should keep an eye out for at your hospital to make sure that your hospital is keeping you safe for your best possible outcome after your surgery. Don't forget to hit that subscribe button, as well as follow us on our social media accounts at Facebook, Twitter, as well as Instagram. I'll see you guys for part 3.